Okay, so now let's talk about Part B, as in boy, Part B of Original Medicare. Remember, Original Medicare consists of two parts, Part A and Part B. Okay, so now we have Part B. When do we sign up for Part B? We have an initial enrollment period, or an IEP, that runs 3 months before our birthday month, the month of our birthday, and 3 months after. It's a 7-month period that allows you to sign up for Part B. Now, what happens if you miss your initial enrollment period? If you miss your initial enrollment period, you're going to have to wait until the general election, which is January 1st to March 31st, to go ahead and sign up. And you will incur a penalty for not taking Part B as a boy when you're eligible during your initial enrollment period, or IEP. But there is an exception. If you work for a company, or your spouse works for a company with 20 or more employees, and you keep the health insurance through that employer, you do not have to take Part B. There is a form on ssa.gov that you can download and you can fill out and send to your HR department. And they will say, Mr. Jones had insurance until this date, and it shows that you had credible coverage during that specific time that you are eligible for Medicare Part B as in boy. And then you submit it with your application, and you bypass that fee because you've had insurance that is standard for Medicare. If you have COBRA, if you have ACA or Affordable Care Act, if you have a medical share program, those are not considered credible coverage, and you will incur a fine. Okay. If you decided that you just don't want to take Medicare and you don't have credible coverage, from the time that you come out of your initial enrollment period, or IEP, you will start to incur a fine until you take Medicare for the first time. When you take Medicare, you can apply for Medicare Part B on the Social Security website. I encourage, if you follow me, you know that I encourage everybody to have an account on ssa.gov, so that way you can keep track of your Medicare information, when you're eligible, your Social Security information, when you should be taking Social Security. You can keep track of all of that stuff. So I encourage everybody to go ahead and get themselves an account on ssa.gov. And that is where you're going to apply for Medicare Part B. It is the easiest and the quickest way to apply for it. You can go down to the Social Security office, but we all know how that works. It takes forever to get an appointment. You can call them. You'll be sitting on the phone forever trying to get in touch with somebody. The easiest way is to log into your ssa.gov account and go ahead and apply that way. Now, Part B has a premium. For the average American, it is $185 per month. Remember, these are 2025 numbers. Every January 1st, it will change, okay? And usually that comes out November and December. We'll know what it is. And then how do you pay for your Part B? There's a couple different ways. One, if you're taking Social Security, they'll take it straight out of your Social Security before you get your funds. That's the easiest and the best way, so you don't miss a premium payment. Or you can use Easy Pay through CMS, which is the Center of Medicare and Medicaid Services, and they will draft it right out of your bank account every single month. Or you can get a paper bill and you'll pay for it quarterly, okay? Now, Medicare is also funny because if you have a higher income, and I'm going to place the IRMA chart right here so you can see the difference. If you have a higher income, you can pay more for your Part B premium. Remember, these premiums are based off of 2 years in the rear of what you filed your taxes on. And so if your income is higher before you've retired, you're going to pay a higher premium for Part B as in boy, and your Part D prescription drug plan. But we'll get into that a little bit later. If you are a married couple filing jointly, you will both pay the higher price also, okay? Even if let's say one spouse is a stay-at-home spouse and the other spouse is the one that worked, then you will both still pay, okay? Medicare is an 80-20 program, meaning that you pay 20% and Medicare pays 80%. Your 20%, Medicare will start paying their 80% once you've hit the deductible. In 2025, the deductible is $257. Okay. Now, let's talk about what Medicare does not cover. Okay. Medicare does not cover, and I get a lot of grief about this, but you can look it up on medicare.gov. Medicare does not cover routine physical exams. They do once a year wellness exam, okay? Medicare, original Medicare, does not take care of dental needs. It does not give you cleanings. It will not do fillings or extractions, okay? Hearing aids, they will not do a fitting for hearing aids or give you a hearing exam, and the same thing for eye exams. But it will take care of glaucoma and cataracts, okay? Cosmetic surgery, Medicare does not pay for cosmetic surgery. Long-term care, we've discussed this in other videos before. They do not pay for long-term care. They only pay for skilled nursing, and that would be paid for with your Part A as an Apple coverage. All right. Routine foot exams, that is not covered. Alternative medications and treatments are not covered under Medicare, and medically unreasonable services are not covered. So Medicare is a policy where you can go anywhere in the United States, and as long as the doctor takes original Medicare, you can stop and see them. Every hospital. Now, and I say that because there are a handful of doctors out there that do not take original Medicare. So while you're calling and making your appointment, it's just best to say, hey, do you take original Medicare? If they say yes, then you can make your appointment with them, okay? So we've covered with original Medicare, Part A in the previous video, and now we have covered Part B and all of the charges. You have your premium every single month, and then you have your deductible that you need to pay. Now let's talk about this, right? Once you have Part A and you have Part B, you can actually add in a Medicare supplement, also known as a Medigap, or a Medicare Part C, also known as a Medicare Advantage. And we'll address those in some other videos, okay? If you guys have any questions about Medicare Part B, put them in the comments and we will address them. Have a great day.